Most people think breathing is automatic, and it is, until the way you breathe starts changing the environment inside your mouth, and sometimes even the way your face develops. We take about 20,000 breaths every day, and most of us never think about a single one, but the route that air takes, whether it enters through the nose or through the mouth, has consequences that go far beyond the lungs. It connects to almost everything we have discussed so far: saliva, microbiome, inflammation, sleep. It all comes back to a simple question: are you breathing through your nose or through your mouth? And sometimes, without realizing it, people spend years breathing through the wrong door. This is the Dental Longevity Show. I am Dr. Mario Parra, and today's episode is called Breathing Wrong. Your nose is not just a hole for air. It is a sophisticated physiological system designed to prepare every breath before it reaches your lungs. When air enters through your nose, it gets filtered. Tiny hairs and mucous membranes trap particles, allergens, and pathogens before they travel deeper. The nasal passages warm the air to body temperature and humidify it, protecting the delicate tissues of the lower airways. And the paranasal sinuses produce nitric oxide, a signaling molecule involved in blood flow, immune defense, and oxygen exchange. Your nose does all of this quietly, continuously, without you ever thinking about it. It is one of the most underappreciated structures in the human body. We think of the nose as simple anatomy, but it functions more like an air processing unit. Filtration, temperature regulation, humidity control, and biochemical signaling, all happening in a fraction of a second with every breath. But when the nose is bypassed, none of these functions happen. The air that enters through the mouth is unfiltered, dry, and cold, and it enters a space that was not designed to be the primary airway, because the mouth was designed as a backup system for breathing, not as the main route. Mouth breathing can start for many reasons: nasal obstruction, enlarged adenoids or tonsils, chronic allergies, deviated septum, even postural habits. In many cases, it begins as a temporary response to a blockage. The body needs air, so it finds another way. That makes sense, but what begins as compensation can become a pattern, and once the pattern is established, it can persist even after the original obstruction resolves. This is especially important in children. During growth and development, the way a child breathes may influence the way their oral and facial structures develop. Muscles of the face, the position of the tongue, the width of the palate, these are all shaped in part by function. And breathing is one of the most constant functions the body performs. When that function shifts from nasal to oral, the developmental environment shifts with it. And by the time someone notices the pattern, it may have been present for years. This is not about blame. Many children breathe through their mouths without anyone realizing it. The signs can be subtle: an open mouth at rest, snoring, dry lips, dark circles under the eyes, a forward head posture. These are not dramatic symptoms. They are quiet signals that the breathing pattern has shifted. One of the most studied consequences of chronic mouth breathing in children is its association with altered craniofacial development. When a child breathes primarily through the mouth, the tongue tends to rest in a low position instead of pressing against the palate. The mouth stays open, and the muscular forces that normally shape the upper jaw and midface during growth are disrupted. Systematic review and meta-analysis published in BMC Oral Health in 2021 analyzed 10 studies comparing mouth breathing and nasal breathing children. The findings showed that mouth breathing children had significantly different craniofacial measurements. They tended to present a more retrusive jaw, a narrower maxillary arch, increased lower facial height, and a reduced posterior airway space. These are not cosmetic observations. They reflect structural changes associated with how the face grew during development. The authors noted significant heterogeneity across studies and moderate methodological quality. So these results should be interpreted as strong associations, not deterministic outcomes. But the pattern is consistent and well documented. This matters because altered craniofacial development is not just an orthodontic issue. A narrower palate means less room for the teeth, which can lead to crowding and malocclusion. A more retrusive jaw can affect the position of the tongue and the size of the airway. And a reduced airway space may contribute to breathing difficulties during sleep, creating a feedback loop between structure and function. What started as a breathing pattern during childhood can leave a structural signature that persists into adulthood. Beyond facial structure, mouth breathing also changes the environment inside the oral cavity, and this is where the connection to everything we have discussed in earlier episodes becomes clear. When you breathe through your mouth, especially at night, the airflow dries out the oral tissues. Saliva production decreases. And as we discussed in our episode on saliva, that fluid is not just moisture. It is a protective system. It buffers acids. It supports remineralization. It keeps the microbial ecosystem in balance. A study published in Frontiers in Microbiology in 2020 compared the microbiota and salivary proteins of mouth-breathing and nasal-breathing children. The researchers found significant shifts in microbial composition across the oral, nasal, and pharyngeal environments. They also found changes in salivary protein expression, including markers associated with oxidative stress. In other words, the simple act of breathing through the mouth instead of the nose altered the microbial landscape and the protective capacity of saliva. And then there is the question of caries. A cross-sectional study published in the Brazilian Oral Research Journal in 2024 evaluated 257 preschool children and found that mouth breathing was associated with a significantly higher prevalence of anterior dental caries. Children who predominantly breathed through the mouth had 57% higher prevalence of anterior caries compared to nasal breathers. This does not mean that mouth breathing directly causes cavities. The relationship is more nuanced than that. But it creates the conditions: a drier mouth, less salivary buffering, a more acidic environment, more favorable conditions for cariogenic bacteria. And those conditions are present not just once, but repeatedly, especially during the hours of sleep when salivary flow is already at its lowest. The route the air takes changes the ecosystem, and the ecosystem determines the risk. There is another dimension to this that often goes unnoticed: the connection between mouth breathing and sleep. A comprehensive review published in Frontiers in Public Health in 2022 summarized the broader consequences of chronic mouth breathing. Beyond the well-documented effects on facial development and oral health, the authors highlighted associations with sleep-disordered breathing, bruxism, and upper respiratory infections in children. This is the part that turns a breathing pattern into a systemic issue. When a child or an adult breathes through the mouth during sleep, the quality of rest may be compromised. The airway may be less stable. The tongue may fall back more easily, contributing to partial obstruction. Bruxism may increase, and the body enters a cycle where poor sleep contributes to inflammation, and inflammation contributes to more oral problems. Sleep is when the body repairs itself, tissues regenerate, the immune system recalibrates, inflammatory markers reset. But if breathing is compromised during sleep, that recovery process is disrupted. And when recovery is disrupted night after night, the effects accumulate. Not dramatically, not suddenly, but consistently. Think about it this way: breathing shapes the oral environment. The oral environment shapes sleep quality, and sleep quality shapes recovery, immune function, and systemic health. It is not a straight line. It is a loop, and the breathing pattern is often where the loop begins. So, what can you do with this information? The first step is awareness. Pay attention to how you breathe during the day. Notice if your mouth is open at rest. Observe your children. Watch how they breathe while they sleep. These are not things most people look for, but they are some of the most important observations you can make. If you notice a pattern of mouth breathing, especially in a child during their growth years, consider consulting with a professional who can evaluate the airway. The causes may be treatable, allergies can be managed, adenoid or tonsillar hypertrophy can be assessed, nasal obstruction can be addressed, and the earlier the intervention, the better the opportunity for the body to return to its intended breathing pattern. For adults, the picture is different but still relevant. Chronic mouth breathing at night contributes to dry mouth, which in turn affects saliva, microbiome balance, and tissue health. If you wake up with a dry mouth, a sore throat, or the need to drink water immediately, your breathing pattern during sleep may be part of the reason. Becoming aware of the pattern is the first step toward addressing it. This is not about perfection. It is about recognizing that something as simple and invisible as the route your air takes may be shaping your oral health, your sleep, and your overall well-being in ways you never considered. Sometimes, the problem is not how much air you get. It is the route the air takes. Pay attention. Your body already is.